Welcome to the Preschool Transitional Kindergarten Learning Foundations, or PTKLF presentation of the health domain. This pre-recorded presentation is part of the series of presentations developed by the California Department of Education in partnership with WestEd that follows the release of the PTKLF. The purpose of these presentations is to provide a snapshot of each domain covered in the publication. And today's presentation is focused on the health domain. We are joined by the writer of this domain, Annabelle Castillo. For an overview of the introduction of the PTKLF publication, including its structure, organizations, and major revisions, please visit our prior pre-recorded presentation titled PTKLF Introductions. The agenda for today is as follows. We will first provide acknowledgments for the contributions of this specific domain. Next, we will provide an overview of the organization of this domain, and then provide examples of foundations in each strand. One for understanding health and wellness, and one for health and safety habits. We will then provide an overview of the diversity of children's developing skills in health, followed by a brief section on how educators can support this development. We will end with a closing. We want to take a moment to list some acknowledgments for individuals who contributed significant time to the development of this domain. In addition to the California Department of Education and WestEd team, we had our lead writers, Joanna Mackey from University of California, Merced, and Annabelle Castillo from WestEd. We also consulted with subject matter experts, Victoria Leonard from the University of California, San Francisco, and Sharon Taverneau-Ross from the University of Pittsburgh. We also had specific reviewers who brought the lens of inclusion, cultural diversity, and multilingual learners. Flora Fagaro from Stephen F. Austin State University, Margaret Gillis from SRI, Dina Castro from Boston University, and Frida Bennett from the Quartz Valley Indian Reservation. We would also like to thank our many educators and interest holders who participated in focus groups and provided feedback. I will now pass it on to Annabelle to talk through the details of this domain.
Thank you. I will first start with describing the domain, the structure and organization of this domain. The PTKLF in the domain of health describe the knowledge and skills that set the groundwork for young children to be healthy and develop into healthy adults. The foundations describe what children should know about health and what health and safety habits they can develop through daily routines in a supportive learning environment. The organization of the health domain includes the first strand of understanding health and wellness, which includes substrands of body and health awareness, body and safety boundaries, nutrition, physical activity, and sleep. The second strand is health and safety habits, which includes basic hygiene, oral health, sun safety, and injury prevention. This is a sample of how the foundations are structured with the sub-strand numbered. In this case, it is 1.3, which indicates it is within the first strand of understanding health and wellness, and the third foundation within the strand focused on understanding the role of healthcare providers. The foundation statements are then underneath this label and describe the skills children can demonstrate in the early foundation, the box on the left, and the later foundations, the box on the right. Below these foundation statements are a series of examples, only one of which is listed here. The first example for each foundation is aligned to demonstrate the developmental progression more clearly. The previous strand structure consisted of 3 strands: health habits, safety, and nutrition. The current version now has reorganized these concepts into two strands: understanding health and wellness, and health and safety habits. Additionally, there is now a foundation on recognizing and communicating about body boundaries, recognizing and indicating when tired, recognizing the body's response to physical activity. These changes highlight current research in the health field. There has also been an update to the examples, which highlights California's diverse population by incorporating examples that show children communicating in their home languages, as well as inclusion of children using adaptations or accommodations. Now, I will present some samples within each strand. The Understanding Health and Wellness strand includes body awareness, body safety and boundaries, nutrition, physical activity, and sleep. The body awareness substrand includes children learning the names of their body parts, learning the roles of healthcare providers, and communicating about health and wellness. The body and safety boundaries substrand includes foundations on children's ability to recognize and communicate about wanted and unwanted touches. Young children are generally capable of learning that physical touch should only occur when it is wanted by them, and that an unwanted touch is never okay. The substrands of nutrition, physical activity, and sleep all relate to maintaining a healthy body and staying well. The health foundations include protective factors such as healthy eating, being physically active, and making healthy food choices, which can have lasting protective health effects. This sample comes from the Body and Safety Boundaries substrand, focused on recognizing and communicating about body boundaries. In the early foundation, children recognize and communicate with adult support about body boundaries, including wanted touches, like a hug from a peer or a high five from a teacher, and unwanted touches, like hitting, pushing, or inappropriate touches. Children also tend to follow trusted adults' guidance about body boundaries. For example, a child communicates to another child, "Hey, you hit me." A teacher notices this exchange and tells the child who hit their peer, "When you hit them, that hurt them and made them sad. Can you try again to communicate what you need?" Then in the later foundation, demonstrate an ability to recognize and communicate about body boundaries with less adult support and more consistently and independently, following and using trusted adults' guidance about body boundaries. For example, a child sees their peer being pushed by another peer and intervenes, saying, "Pushing is not nice." So you can see the progression goes from needing some adult support to communicating body boundaries in a more consistent way and on their own. This sample comes from the nutrition substrand, focused on understanding a variety of foods. In the early foundation, children demonstrate an emerging understanding that eating a variety of foods helps them grow and feel good. They typically choose familiar foods, including familial and cultural foods, although occasionally they're also open to trying new foods. For example, a child states, "I like tofu and cabbage, just like my grandpa. We use chopsticks." Then in the later foundation, children demonstrate an understanding that eating a variety of foods helps the body grow and feel good. They begin to choose a greater variety of foods at mealtimes, including familial and cultural foods. For example, a child communicates, "My grandma made me chicken, rice, and corn because it helps me grow and play." So you can tell the progression goes from a basic understanding that variety is good, but more often choosing familiar foods, to a more sophisticated understanding on the importance of a variety of food for the body to grow, and are able to choose a greater variety of foods in addition to familiar foods. Health and safety habits strand covers the health habits or actions that children do as part of their daily routines in an early education program. The 4 areas covered under health and safety habits are basic hygiene, including hand washing, and habits that prevent infectious diseases and infestations. For example, wearing a mask. Oral health, for example, brushing teeth, sun safety, and injury prevention. This sample comes from the oral health substrand, focused on toothbrushing. In the early foundation, children demonstrate knowledge and follow some steps of the toothbrushing routine with adult supervision and instruction. For example, after the teacher demonstrates, a child uses a toothbrush to brush their outer teeth and then spits. Then, in the later foundation, children demonstrate knowledge and follow more steps of the toothbrushing routine and demonstrate knowledge of when toothbrushing should be done, with limited adult supervision and instruction. For example, with some teacher guidance, a child applies a smear of toothpaste from their own tube or piece of wax paper, brushes all 3 sides of teeth, like the outsides, insides, and chewing surfaces, and then rinses and spits. So you can tell the progression goes from some basic steps of toothbrushing with assistance to being able to follow more steps with toothbrushing with more independence, like brushing all 3 sides of the teeth and spitting and rinsing. This sample comes from the injury prevention substrand, focused on following safety rules. In the early foundation, children follow indoor and outdoor safety rules, which are rules that protect children from danger, risk, or injury, with adult support and prompting. For example, a child follows a rule to walk inside the classroom, though they need a reminder when they get excited. Then, in the later foundation, children follow indoor and outdoor safety rules with less adult support and guidance. For example, a child reminds another child, "The teacher said not to run in the classroom." So you can tell the progression goes from following some safety rules with adult reminders to following safety rules with greater guidance. I also want to highlight the diversity of developing health knowledge and skills. The examples in the domain also show children's awareness and knowledge of healthcare providers within their cultural communities. For instance, some children are familiar with health advocates in their communities that play the role of lay community health advocates, such as promotoras, a term in Spanish that refers to a trusted person in the community who is a health advocate and educator. Native nations and tribal communities also have healthcare workers, like promotoras. These health advocates typically speak the home language of the family and share their cultural values and practices. Cultures and families vary in norms around physical touch. While some cultures may use physical touch when interacting with each other, for example, greeting or when comforting, other cultures practice different norms of physical boundaries. However, children may encounter a variety of cultural norms and expectations regarding physical touch in early education programs. Teachers can communicate with families regarding children's comfort level with various types and amounts of touch to determine what is appropriate. The management of health conditions, prevention of complications, and promotion of health are critically important for all children, especially for children with orthopedic impairments or health impairments. The examples in the health domain illustrate how children with diverse needs and abilities may express the behaviors described in the foundation statements. For instance, the examples show how children with asthma may communicate about their condition, or that children with physical disabilities may need adaptive equipment to engage in healthy habits and practices. Children with orthopedic impairments or health impairments may also have meal plans, feeding practices, and preferred physical activities that can all be incorporated into how they engage with and develop health knowledge and habits. The foundations encourage teachers to individualize health practices as needed. I will now touch on some ways educators can support children's health development. A crucial element in supporting children's healthy development is to create trusting and safe environments for children and adults. The foundations aim to convey that in early education programs, children are safe with adults and children. Children are learning self-control and self-regulation of their own frustration or anger by not hurting themselves or others in their community. With the support of trustworthy teachers who provide racially and culturally responsive care and build respectful relationships with all families, a school can be a safe place for everyone. The domain underscores the importance of supporting teachers and building trust with children, establishing safety and predictability in the classroom, and empowering children to say no to hurtful or unwanted touches from peers or adults. Altogether, these ideas contribute to a safe environment for everyone. Establishing safety rules is foundational in every early education setting. It's important to establish safety rules at the beginning of the year and remind children often of these rules, especially at the start of the school year. You can also provide opportunities to role play or practice rules, like what does walking feet look like? Or what is an inside voice versus an outside voice? Or how do we go down the slide safely? Another strategy is to ask children to share a safety rule they will follow before a transition, like when lining up before going outside. Another element central to children's development of health knowledge and practices is healthy nutrition habits. Early education programs should have a variety of healthy food choices at mealtimes and water available for everyone at predictable times. Mealtime routines provide opportunities during the day to support young children's healthy nutrition knowledge and practices. Children learn that mealtimes involve nourishing their bodies and are also learning social skills, such as waiting, turn-taking, and sharing. Children's experiences of mealtimes are rooted in cultural practices at home. For instance, children may be exposed to specific eating utensils related to their family meals. Similarly, some children may not eat certain foods based on religious or cultural practices. Teachers should create consistent and healthy mealtime routines while honoring children's diverse home experiences around food and mealtimes and working closely with families to gather information about those cultural practices. When modeling about health topics, it is also important to model listening to your body, like saying, "Oh, my tummy is hurting a bit. I think I'm hungry." Or, "My tummy feels full. I think I will stop eating." Or when outside, modeling getting a drink of water because it feels hot and I'm getting sweaty. This means that my body needs water. And learning to rest or seek shade. Also, before nap or rest time, checking in about how tired children might be feeling and communicating, "Well, when I feel tired, my eyes feel heavy," or "I don't feel like running around. I may need to rest and rest my eyes and my body for a little bit," as well as modeling how to communicate when you don't feel well and when you might need more personal space. As part of children's daily routines, it is also important for teachers to model self-care, such as basic hygiene and other health practices. For example, teachers can model hand washing. "Now I'm washing my hands before getting ready for lunch so I don't spread germs onto the food." Or after staying home with a cold, "I missed you yesterday when I was sick at home. My body needed time to rest and I didn't want to get anyone sick." Just as important, teachers need to trust children's capacity to take on some, not all, responsibility for self-care and health behaviors that benefit themselves and the group. For example, understanding health and wellness concepts and practicing health and safety habits allow children to articulate how they are feeling individually and that behaviors such as hand washing and covering their cough benefit everyone, including adults. The health and wellness concepts and habits children learn in early childhood set the foundation for well-being throughout their lives.
In closing, for a more detailed view of the health domain, please read the full document published on the CDE's website. This is also the final domain in the CDE series of PTKLF presentations. To visit the CDE website to access the other pre-recorded presentations, as well as the PTKLF publication, please visit https://www.cde.ca/PSFOUNDATIONS.ASP. Thank you.